Here to share some really fantastic news. And that is that we are in a very different and much safer place than we have been before. And as a result, we're able to make some significant changes in our county. Just by way of illustration, our case rate now is a third of what it was less than a month ago. Our positivity rate is 0.5%. Which is the lowest that we've ever recorded. And most importantly, over 75% of our residents ages 16 and up have had at least one shot, and nearly 60% of those 16 and up are fully vaccinated, fully protected against COVID. So this is really fantastic, and we're in this safe place because of all of you who have gone and gotten vaccinated and helped make our county a safer place. We have a clear path out of this pandemic. The COVID vaccines authorized by the Food and Drug Administration are incredibly safe and incredibly effective. We know that they prevent illnesses, hospitalizations, and death. And now, based on the latest research, we are also confident that they prevent people from spreading COVID. That's somewhat new and very important. The vaccines prevent people from spreading COVID. From the very beginning of this pandemic, we have always sought to understand what the latest science is showing us and to base our policy decisions on evidence and to change our policies when the evidence tells us that that's what we need to do. And we've always tried to adapt this for our local conditions on the ground, and so today is no different. With increasing vaccination and this new evidence that vaccination prevents transmission, today I am retiring many of the restrictions that have been in place for a long time. One of these, such as remote working wherever possible, simply isn't necessary any longer because of where we are. So I am rescinding the October risk reduction order, and I'm replacing it with a very simple order. And this order does just three things. One, it requires employers to determine the vaccination status of their employees. Two, it defines safety rules for employees who remain unvaccinated. And three, it continues to require that workplaces and schools report to us when they have a COVID case. And that's it. So as James mentioned, as of tomorrow, we'll be in the yellow tier, so we'll need to follow the state's yellow tier rules. And we will also be following the California Department of Public Health's masking rules, which means that for now, we'll all generally continue wearing our masks indoors for the time being. But people who are vaccinated, and most others, we don't need to wear our masks outdoors. And James and I have removed our masks today to model that behavior for you. I will admit to you, it is difficult after wearing this mask for so long to feel comfortable without it on, despite the fact that I'm vaccinated. And it's going to take time for many of us to make that change. Our new order ensures that everyone is safe while employers determine the vaccination status of their workers and while we continue to get even more of our residents vaccinated. We're continuing to make every effort in our county to reach our hardest hit communities so that we can ensure that everyone has access to this life-saving COVID vaccine. Our communities that have been hardest hit have been our focus since the beginning of the pandemic, and they will continue to be our focus. We've created lots of access in these communities, lots of access to vaccination, and will continue to be laser focused on equity. So for the first time in a long time, I feel optimistic. For a while, it seemed uncertain to me whether the vaccines or the variants would win. And I think that Team Vaccine is in the lead, holding the lead, and will win. But of course, we need everyone who's eligible to get vaccinated, who's eligible to be vaccinated, to go on and get vaccinated. And we need everyone to do this just as soon as we possibly can, so that we can definitively win this race and bring this health emergency to a close, at least in this area. So our goal now is to get as many people vaccinated as quickly as we can, so that we can protect people who aren't yet vaccinated or aren't eligible to be vaccinated in the meantime. This order will help us in doing that, and it will also allow many people who are vaccinated to begin to recapture some of the things that matter most to us. So if you haven't already gotten your vaccine, please do so as soon as you can. Visit our website, sccfreevax.org. Plenty of information of how to get vaccinated and where. And let's all look forward to a wonderful summer where we can all be and feel a bit safer and return to normal. Thank you so much, and I'm going to turn it back to James.
As Dr. Cody mentioned, today's health officer order replaces the October risk reduction order, and it has specific focused measures to continue to ensure safety in our community. This means the prior local requirements that were in place on top of the state's framework are now being retired. That includes the directive to maximize telework, as well as the requirement to submit and implement a social distancing protocol. And that was an across-the-board requirement on all businesses in our community. Again, those requirements are being rescinded effective tomorrow. Instead, this new limited focused order has three simple requirements. One is to continue to report COVID-19 cases, just as before, to the County Public Health Department and cooperate with any contact tracing and case investigation, and continue to quarantine unvaccinated close contacts. Second, continue to use face coverings indoors as required by the state. And third, all businesses and governmental entities must determine the vaccination status of all their personnel within 14 days and follow some additional safety rules for those staff who are not yet fully vaccinated. Currently, some of the rules that businesses need to follow for workplace safety are different for those who are fully vaccinated and those who are unvaccinated. For example, quarantine for close contacts is not required for people who are fully vaccinated. Cal OSHA has proposed new workplace safety rules that will make those distinctions stronger. And in certain settings and contexts, face coverings are already not required for those who are fully vaccinated. That's why this new health order requires all businesses and entities to determine vaccination status of their personnel in the next 14 days. If someone chooses to decline to report their status, they must follow the safety rules for those who are unvaccinated. To make this easy, we've created a simple form that businesses can use to obtain this information and meet this requirement, but they are also free to use their own tools if they choose to do so, as long as they meet those requirements. We are one of the safest communities in the nation because our community is vaccinated. But if you haven't yet gotten your shot, there's no better time than right now. Appointments are really easy to get. Drop-ins, walk-up appointments, really accessible and available. All you need to do is visit sccfreevax.org. All the information is there. There's really no excuse. Over the last several months, it's become clearer and clearer that getting vaccinated is the single best thing that you can do to keep yourself safe, but also to protect your family, your friends, your neighbors, and your coworkers. Based on everything we know, this is our best pathway forward, and we urge everyone to get vaccinated right now. It's never going to be easier or simpler. There will never be more access than there is right now. Get fully vaccinated at this moment and visit sccfreevax.org to learn how to do so. I'm going to turn it over now to Supervisor Susan Ellenberg.
Good afternoon, everyone, and thank you very much for joining us during your lunch hours today. I want to start with an abundance of gratitude to all of our county residents. You have done everything you possibly could to keep our community safe. Because of these efforts, our case rates are declining sharply. We're making tremendous progress, as you heard, with vaccination rates, and we are entering the yellow tier. We are getting closer to pre-pandemic normalcy. The light at the end of the tunnel is brighter and closer than ever because the residents of Santa Clara County have stepped up. So I'm talking maybe to those of you who have not yet gotten your vaccination. That is the first question out of my mouth to everyone I encounter these days. On Zoom, on the phone, walking in the neighborhood or on the trail, picking up groceries or pet food. Fortunately, the answer is yes, more and more often, and I hope that all of you can say the same. Getting vaccinated, as James Williams said, has never been easier. There are multiple sites throughout the county where residents 12 and older can go 7 days a week. And if you need a ride to your vaccination, we've got you covered. VTA has created an interactive map for the public to find a list of current vaccination locations, along with the bus or light rail routes to take to each site. Transit trips to vaccination sites are free. The county and VTA have launched a free door-to-door service to transport patients to their vaccine appointments. Accessible VTA paratransit vehicles will pick patients up, take them to their appointment, wait for them, and then provide the return trip. Anyone for whom transportation is a barrier to getting vaccinated can utilize this service 7 days a week. Call the COVID-19 Assistance Navigation, it's CAN-19 resource hotline at 408-809-2124 at least 48 hours prior to your vaccine appointment to request this no-cost service. VTA can provide up to 50 rides per day. I encourage our residents to keep up this great work. Continue to get tested when you think you have been exposed to the virus, and please get vaccinated. Get your 12 to 15-year-old kids vaccinated, either by visiting a walk-up site or by scheduling an appointment at sccfreevax.org. We are getting through this together. We're so close. Thank you very much. I'm pleased now to call up my colleague, Supervisor Otto Lee.
Good afternoon. I'm Otto Lee, Santa Clara County Supervisor for District 3. Today is a really exciting day to announce that we are going to enter yellow tier on Wednesday, tomorrow. This is really something that's exceptional. We've been in this COVID situation since last March. 14 months have passed, and our life has certainly been upended in so many ways. Vaccinations have finally been proven to work. And that one really exciting news to say is that our supply of our vaccine is equal and almost exceeding the demand here. So therefore, it's really easy to get our vaccines now. By getting the 2-dose vaccines or your single-dose vaccine, whichever you choose, has proven to not only prevent yourself from getting the COVID, but also the transmission of COVID to other people as well. This is truly exciting news. And I'm also excited to say that more than three quarter of our residents has already got at least the first dose, and that's over 1.2 million doses just in the Santa Clara County alone. This is exceptional, and close to 60% of our residents is actually fully vaccinated. Certainly, I want to say so much thanks to our residents, but also to our county staff that has been removed from their positions from the EOC and everywhere they've been deployed to make this happen. For those of you who have gone through our vaccination program, you understand how smooth, how great that process is. And I urge everybody, as my colleague Susan Ellenberg has said, go to sccfreevax.org if you still haven't been vaccinated, and tell everyone, get vaccinated now. Thank you very much.
We'll now start taking questions in English for media here before moving on to Spanish. We'll start with Bay City News. Please identify who your question is for.
Thank you for the question. The question is it fair to say that the biggest change in the health order is lifting the work from home mandate? As many of you know, we made significant changes to the health order in March. Those were the most significant changes. And so the big change from now to then is two things: lifting the remote worker policy, and businesses no longer need to do and post social distancing protocols. So it's the current order is quite focused, and it's quite focused on employers determining vaccination status for the safety of all. Thank you.
This is a question for Dr. Cody. You previously warned that relaxing rules or reopenings would lead to more infections and perhaps even to more deaths. Has the vaccine fundamentally changed?
The question is around my previous comments about relaxing rules and seeing rise in cases and deaths, and does the vaccine change that? And my answer is absolutely yes. We are in the position that we are in now because of our high and increasing vaccination rates. It has made all the difference in the world. All the difference in the world.
Roger, just a quick follow-up. Could you talk to us about the vulnerability of the still hundreds of thousands, if my math is right, of people who aren't vaccinated?
Right. So the rules that we continue to have in place and the state's rules around masking are designed to protect people who are not yet vaccinated or not able to be vaccinated because of age or medical status or what have you. The more people that are vaccinated, the better we can protect those who are not vaccinated. That's just kind of a fundamental, central tenet of vaccination. You vaccinate to protect yourself and to protect those around you.
Dr. Cody, can you clarify? I'm a little confused about the question on working remotely versus an office worker. Are we talking about the same thing there, or what changes from today to tomorrow if I work in an office?
I might let James talk this because there's both rules that we have as well as Cal OSHA. It could be complex. Do you want to take that one, James?
Sure. So the current order that's been in place for many months requires maximization of remote work to the greatest extent possible. That obviously mostly applies in traditional office settings, but that has been a mandate in the health order. That is going away effective tomorrow. So there's no longer a requirement to maximize remote work or telework. And as a practical matter, that will probably have the most significant effect in traditional office settings.
Is there an option then for management or for a company or corporation to follow that, or can they stick with what's going on now if they want to?
There is no COVID-related reason for folks to continue to maximize remote work. There may be other reasons that a business chooses to do that, and that's obviously up to them. This isn't a mandate on how they run their operations. But what this is signaling is that there is no longer a COVID-19 health-related reason to be maximizing remote work.
Hi, this is a question from Maureen Naylor, and my name's Steve. KTVU 2. The question is, some folks are wondering if it's a HIPAA violation to ask employers to provide information about being vaccinated.
So the question was, is it a HIPAA violation for employers to ask people about vaccination status? And the answer is no. And we've actually created a form to help employers meet this requirement. One of the options available on the form is for employees, if they wish, to decline to provide their status. And that's a box that they could check. However, if they do so, they will be treated for the purpose of workplace safety rules as unvaccinated.
So that's how it gets around the law.
It's not getting around the law, it's compliant with the law, and we've always been very focused on ensuring that our rules are compliant with all applicable regulations and statutes.
KCBS? Matt with KCBS, probably for Dr. Cody, although maybe appropriate. In the lead up to all of this, I know local counties have put a lot of resources into education, ESAs, making sure that their community are aware of all these restrictions, especially in regards to masks. How do you message now going the opposite way
Sure. So the question is how do you message these shifts, and in particular with respect to masking or face covering requirements in light of the CDC's guidance from Thursday and the state's masking requirements. And a couple things I would share on that. First, one of the things that we've done at the local level is this order aligns completely with the state's face covering rules. So there is no difference between the local requirements and the state requirements regarding face coverings. So that should help simplify things. The second is that we do follow, and we have to follow the state's rules regarding face coverings. The CDC, and this is kind of an important civics lesson maybe about how we're structured in the United States, but the CDC makes important recommendations, but those recommendations are only turned into requirements at the state and local level in the realm of public health. And so the state of California has its face covering requirements. Businesses and individuals in our county need to follow those requirements, and the state has signaled that they're taking this month to help ensure that more people get fully vaccinated before making additional shifts. But our order is not just in alignment with the state, but also in furtherance of that effort. Now is the time to get vaccinated. Go to scfreevax.org, and then you won't have to worry about what might be the case after June 15th.
ABC 7?
Hi, this is Brenda with ABC 7 News. So what's the plan in Santa Clara County from June 15th? Is your county going to expand the mask order or be a little bit more strict? Anything going to change compared to what the actual state is going to implement?
Well, as we have throughout the pandemic, we will assess what the state puts in place and proceed based on that. So we'll see what rules the state specifically has. I do think that one really clear message from today's order and what you heard from Dr. Cody, and she may wish to elaborate, is that vaccination is the most significant thing that you can do, and that's why we're having workplaces and businesses and entities determine vaccination status of workers, because we think that probably more and more safety rules are going to be different based on vaccination status.
Will Santa Clara County come up with full mask guidelines?
I think that depends on what the state has in place from June 15th.
Are there talks to possibly come up with their own guidelines for this in Santa County?
What we'll do is what we've done since the beginning of the pandemic, which is look at the local data, vaccination rates, case rates, positivity rates, look at the state policies, and then decide whether we need any adjustments based on local conditions. And our numbers have been changing rapidly over the last month, all in positive directions. So it's difficult to predict now where we'll be on June 15th. I also just wanted to say something about the masking, and I know that it's been a bit confusing with CDC issuing guidelines and then the state's masking guidance. And what I want to say is this. The CDC got the science right. It's really important for all of us to understand and really rejoice that we now have evidence that vaccinated people are very unlikely to spread COVID. So that's fantastic, and that's what was really behind the masking guidance. The state has taken action that I also think is fantastic. They're keeping their masking policy that everyone has become accustomed to in place for another month so that we can all figure out how to implement it, right? This is a big change, and it takes time to figure out how to implement it. So the state has given us time. And then we've taken a step that we hope is helpful, in that we've given businesses specific directions for how to implement this, for what to do. I hope that helps.
So how will, and this is maybe a question for county council, but how will a business with a fully vaccinated staff look from a staff that doesn't have
So the question is, how will a business that has fully vaccinated staff look different from a business that doesn't, or maybe has a mixed staff? I think the simplest thing to point to right now is Cal-OSHA has proposed regulations. They haven't been adopted yet, but they're going to be considered on May 20th, so later this week. And those regulations very clearly differentiate between what's required in the workplace in terms of safety rules for those who are fully vaccinated and those who are not. For example, the proposed regulations say that if you're in a room where everyone is fully vaccinated, you do not need to wear a face cover. And it also, if you're in an environment where everyone's fully vaccinated, physical distancing requirements are relaxed. Those are just two examples. We'll see what the final rule is that's adopted, but I think we foresee that there will be more along those lines, just like, for example, today, if you are a close contact to a case, you do not need to quarantine if you're fully vaccinated. You do need to quarantine if you are not fully vaccinated. That's in place right now. And so that's why it's all the more important, number one, for businesses to know the vaccination status of their workers, and that's one of the key pieces of this health order. And second, for everyone in the county, if you are eligible, get vaccinated, get fully vaccinated right now. If you've only gotten one dose and you've been waiting on the second, get the second. We've seen a little drop-off between first and second, not a lot, but we've seen a little drop-off between first and second doses. You need the second dose if you've gotten the Moderna or Pfizer vaccine in order to be considered fully vaccinated under the state's rules, under the CDC guidance, and under the local order. So that's critical as well.
Before beginning in Spanish, we'll take one final question.
Should businesses be allowed to compel or require their employees to be vaccinated? And is that legal?
So the question is, should businesses be required to compel employees to be vaccinated, and is that legal? The first thing I want to be very, very clear, there's nothing in the health order that mandates vaccination. It is not a vaccine mandate. I want that to be very, very clear. The requirement is to determine people's vaccination status, and then safety rules are in place accordingly. But there's not a mandate for vaccination. The question is whether businesses could adopt mandates, they obviously need to consult their own counsel and their own specific workplace rules. But in general, that answer is yes, and that's something that they'll have to consider on their own. We know that several university systems, for example, have come out with requirements that they'll have in place in the fall for students and staff. And that is certainly a tool that they could choose to have. But just to be, again, very clear, the order itself is not a vaccine mandate. It does mandate that businesses determine vaccination status.
So just to be clear, if a business were to mandate that its employees were vaccinated, that is legal?
They need to look at their specific context of their specific rules, and I'm not in a place to give them individual legal advice. But in general, that's something that businesses can do.
Thank you, everyone. We'll now begin in Spanish. Roberto?
Muy buenas tardes, mi nombre es Ricardo Romero Morales, soy oficial principal de información pública para el condado de Santa Clara. El día de hoy venimos aquí con todos ustedes con muy buenas noticias. Estamos en un lugar muy diferente y mucho más seguros que hace unos meses. Y como resultado, somos capaces de hacer cambios aquí